common disability in the US. And doctors diagnose arthritis as affecting about 49.9 million people in the US. And these are old statistics. I think currently it's about 30 something million. So it went down, which is good. Osteoarthritis and rheumatoid arthritis are the two that I'll be focusing on, because osteoarthritis is the most common and rheumatoid is the most disabling. So those are the two that are usually focused on. So would anyone like to guess how many types of arthritis we have in general? Any?
I think I read somewhere that it was over 100 kinds.
Okay.
Am I crazy?
All right, so I do have a question here. So how many types of arthritis are there? So even I was surprised to find out it's actually more than 100. So, and there's so many types. So here we have 4 of them. We spoke about this last week as well. The gout or gouty arthritis, they sometimes call it, which is the one that forms when you have too much uric acid in your blood. And it causes, like it creates these crystals and they're very, very painful. Feels like it's usually in the great toe a lot, but it feels like it's throbbing. It's very painful. People complain that they can't even wear shoes because it's so painful. So you have, and I think with gout, there is a saying that it's like a rich man's disease, because usually it's people who are eating a lot of proteins and their bodies cannot break it down. So you have like these purines forming the crystals. So purines are a type of protein. Then we have like rheumatoid arthritis. This is systemic. It's in the blood. It has to do, it's an autoimmune disease. So it creates a lot of pain in the entire body. You have the psoriatic arthritis. This would be people who have psoriasis. They develop this type. And then we have osteoarthritis, which is the one that's wear and tear of the joints. Osteoarthritis, I always try to remind people as well, it's not just wear and tear. Sometimes it develops when there's injury. A joint is injured and that injury is not treated the way it should. You know, I was telling someone the other day, like I was moving up closer to my desk and I hit my knee. When that happens, you should immediately put some ice, you know, attend to it. If it's still paining, you use some anti-inflammatory medications if you can use that, if it's not contraindicated with any of your medications. And you keep putting ice until that inflammation goes away and you feel like, you know, there's nothing there. Oftentimes when injuries are left, you know, left without any treatment, injuries develop into arthritis, osteoarthritis. So that's something to always remember. So in recapping this as well, I have osteoarthritis. It's hereditary joint overuse. It has to do with injury, overweight. If you're overweight and you're, you know, there's so much weight on your body, so your joints are just being like traumatized daily from like walking, maybe the weight on your knees. It's considered non-inflammatory. Now, some people may argue this. So the initial pathology of osteoarthritis is not an inflammatory process. It's to do with the things that I mentioned before, hereditary joint overuse, etc. However, osteoarthritis in its chronic phase does have some inflammation. So it's considered non-inflammatory. It's a degenerative joint disease. So it happens a lot of times as you get older, you start to develop it because you've been living in your body for a while. So your joints are getting older. There is a fallacy though. Some people think it's like, it's a part of aging. It's not a part of aging because not everyone gets this. It's developed by some people as they get older. So osteo has to do with the cartilage deteriorating. And which is why it's considered asymmetrical. It can be just on one side. It's not on both sides, as you'll see with rheumatoid arthritis. That's symmetrical. So rheumatoid, as we said before, is autoimmune. The immune system attacks healthy cells. It creates a lot of inflammation, swelling, pain. And because of that, the bone erodes. So there's bone breakdown. For osteo actually wanting to remember, sometimes they consider it as bone growth because the bone, because it's traumatized and it's trying to survive, it starts to grow outwards. And hello, is someone saying something?
Okay. So you met no, yeah. Where was you in the hospital?
Also, I can hear talking, but I don't know if that's for me. But anyway, so so with osteoarthritis, you have bone spurs and extra bone that's growing, and that's considered, like additional bone growth. In this case, for rheumatoid, bone is eroding. So that's a big difference as well. And it's symmetrical because one of the things happens when you go into the doctor, they ask you questions. Okay, where are you having the pain? You may say you have pain in your right knee or left knee, but let's say you go in and you say, oh, I have pain in both knees. They're, initially they'll suspect rheumatoid arthritis because since it's systemic, it affects the entire body. So there's no differentiation usually. So it usually affects, if it's affecting one side, it usually affects the other side. Whereas for osteo, the difference is it affects usually one side. Of course, we can have variants to that. So osteoarthritis, just so you can have an idea of how it presents, sometimes these symptoms, we have these symptoms as well. And oftentimes people are trying to decide which one they have. Of course, you'll go to your doctor, but when you're thinking of it in terms of giving the doctor the history of what's happened with you. So for osteo, the pain tends to develop gradually. And you'll have it in moments where you have pain, maybe in the morning, maybe all day you have no pain. And then it's intermittent and gradual. So for instance, with osteoarthritis, it would be where a patient is presenting and they'll say stuff like, the doctor, I've been having this pain for the last 6 months. I don't have it every day. Sometimes my knee is stiff. Sometimes, sometimes they'll say, I have the pain in the morning. Maybe later in the day, there's no pain. Maybe in the evenings, let's say they're working doing like a desk job. They'll say, oh, sometimes after I sit at my desk for 2 hours, when I get up, I feel stiffness or I feel pain. That sounds more like osteoarthritis. For location, osteoarthritis is usually in the hips, knees, lower back, neck, feet, fingers. And these are joints that we use a lot. And the type of stiffness is different. So for osteo, it's mild morning stiffness. And you see they're saying mild. And it often goes away after maybe 30 minutes. So there's a specific question the doctor sometimes will ask, whether after 30 minutes, do you still have pain? For osteoarthritis, that's usually a no. Usually the pain is at one time in the day, usually in the mornings because you were sleeping and your body's a little stiffer. However, as I was saying before, if when you're sitting and you're having that stiffness, that can usually be osteoarthritis. It's more about movement. For rheumatoid arthritis, it's, as we said, it's an inflammatory disease. So because the immune system is being attacked, the inflammation is in the entire body. It attacks the tissues as well as the joints. And it does cause pain and stiffness, but you also have swelling. Maybe you'll have a fever, a low-grade fever. Redness sometimes tells you it's rheumatoid and not osteo. Location would be in the joints, hands, wrists, and feet. And the type of stiffness is a little different because the stiffness is usually for a longer period of time. So after 30 minutes, you might still be stiff or you'll still be having pain. Occasionally, the prolonged joint stiffness in the morning is the first sign of rheumatoid arthritis. So someone is going to be, they'll wake up with pain and it continues. And that's usually the difference between the two. Any questions? Okay, so here's a picture that shows in a simplified way the difference of what someone's knee can look like. For osteo, if you look, you'll see this is the cartilage, and in osteoarthritis, it's very thin. So the bone ends up rubbing against, like the bones would rub against each other, and that's what people would usually call bone on bone. And that's what creates a lot of the pain in osteoarthritis as well, and the inflammation. And for rheumatoid, you can see the cartilage here, it looks fine. However, the bone is eroding, and then there's redness and swelling, and there's a lot of inflammation here. The synovial membrane is like inflamed and red. So this is a picture that shows classical differences between the two.
Roberta, you have a question?
I have a
Pardon
question.
me?
Could you go back one
Yeah.
picture? On the osteoarthritis, it says bone and the bone is on bone. And somebody just recently said to me, she was diagnosed with that and she was told to try a gel that they insert in there to, I guess, prevent the bone on bone. Is that something that's actually done nowadays?
So I think what you're talking about would be something like hyaluronic acid.
I don't
Yes, it sounds like, I mean, I don't know what the person said, but it sounds like that, right? So I didn't put those specific things in there. There's something called glucosamine and hyaluronic acid. And I remembered when I was doing my bachelor's in nutrition, these were big things. I finished my bachelor's, that was 2004, I believe, yes. So, and that was a big deal in nutrition, this hyaluronic acid and chondroitin sulfate. Because people at that time, researchers thought that those things were helping arthritis. Actually, now the research is showing that they do not help that much. It does not last. It does not really help. So there are other things that are being used now. So I actually did not put those two in my slides. Later on, you will see some of the injections that I put. One of them is the hyaluronic acid, because hyaluronic acid is replacing the missing hyaluronic acid in the cartilage when it's worn away. So for mild arthritis and moderate, some people still use that. But those creams and lotions and the stuff that you put, the gels, they're not as effective. So thanks for that question, Roberta. That's why we missed you. You have all the good questions. Rini took your spot last week. Okay, so when do you get an expert opinion? So the doctor you'll speak with is a rheumatologist. And you're going to go to your rheumatologist. Of course, you'll go to your primary care doctor first, but the primary care doctor will refer you to a rheumatologist when you have tender, painful, or stiff joints, and when it's consistent. So this is usually for a period of over 6 weeks. If it's not going away, you're still having these symptoms. Most people go to the doctor, and this is from my experience, and I was told this, and I am an example of that, when the pain is unbearable. People just try to bear the pain, and then after a while, they're like, I can't bear this anymore, and then they go to the doctor, which is usually not good, because, all this time you're having the disease process happening. So when there's redness or swelling around the joint, if you have a fever with that, that's when you should go to the doctor. If you're having trouble moving a joint, if it's really stiff, you can't move, you should go to the doctor, because of course, this increases your risk for falling. I've seen patients fall like this before because their joints literally seize Or I've heard people say, oh, I was walking and I fell and I did not even know, I didn't trip or anything, I just fell. Sometimes that happens with osteoarthritis because when there's inflammation or when there's joint disease, the muscles and the ligaments around that joint, they become weak. And that weakness, it causes you to buckle, or, you're moving and your foot is going to do something that it maybe shouldn't be doing in an awkward way, and you'll fall. So you may not even realize that it's something more serious. So if you're having these falls and you're not sure why you're falling, you should definitely go to your doctor. If you're having trouble doing everyday tasks, your ADLs, it's too painful, you should go to the doctor. If there's back pain that lasts more than a few weeks, usually they say 6 weeks at least more. If it's 6 weeks or more, definitely check with the doctor. And if the symptoms are causing weakness, like I was mentioning with, weakness like you're buckling, or, you're not able to sit up straight because your back is so, you're having like, some people have spasms after a while because there's so much deterioration, nerve endings start to become compromised. So, any questions? Okay, so taking care of yourself. So most of this presentation is about self-management. So of course you follow up with your doctor visits. You manage your pain and your symptoms. So in managing pain, I wanted to discuss ice, because one of the things that I recommend to anyone, and I know this from personal experience, ice works wonders. Sometimes you use ice and you don't even have to use pain medications because it actually decreases the pain. It gets the inflammation away from the site and it relieves the pain. So, and I've done this myself. If after an hour, hour and a half, and the ice doesn't work, then you can, of course, use pain medications. You take your medications as prescribed. Arthritis, prevention and also maintenance is a lot to do with exercise, which you'll see I have more slides about this. You want to keep your body flexible and mobile so you can do things. So staying active is important. Sleeping 6 to 8 hours a night is important. So if there's any reason that you're not able to sleep, you should have it addressed, because we all know that sleep, when you sleep, your body recharges, your cells rejuvenate, and then your inflammation goes down. So your body can really take care of itself when you're up. When you're up and injuring your body, basically, because that's what we do when we're awake. We're like injuring ourselves. So you eat a balanced meal daily, because eating a balanced meal, of course, provides you with, the nutrients that you need to repair your cells. Strengthen muscles to prevent falls. So if there's any injury from tendonitis or, any specific injury that can be strengthened with physical therapy, you should do that, because if it's not, injuries end up becoming chronic. And then of course that can lead to osteoarthritis as well.
So I would like to ask a question. You
Yes.
say ice.
Mm-hmm.
I've been diagnosed with osteoarthritis. Yeah. And I have osteoporosis as well.
Okay.
But the thing is I'm doing exercise. I had physiotherapy, and the x-ray shows bone on bone, like you showed, just like that.
Mm-hmm.
But I don't really know, like you said, this is what would worry me now is, since you said that I feel I'm looking after it, but I feel it's deteriorating. And I don't know whether this would lead to an operation or whether I should just continue with the exercises, but I use heat too. Like when I feel pain, like right now, I'm trying to empty the dishwasher. When I bend down or bend into the fridge, or when I bend down to the floor, there's more pain because it's in my hips. So I just lie down for a half an hour, put my heating pad on or my vibrator, heat, and it gets better. Then I feel better for 5 hours.
So there's a thing with heat and ice that I think sometimes people, misconstrue. So heat, what is the heat doing? The heat brings blood flow to the site. And that's important to know because what you're doing, it's good. However, the ice does something else. The ice gets rid of the inflammation. So I think for you, what I'm hearing, I mean, it sounds like you're having, if pain medications working for you as well or no?
I'm not taking any medication.
You just use the heat.
I just use the heat and I take a hot bath and I do exercises. I do lots of exercises to stretch it with yoga and stretch and strengthening that they showed me in my physiotherapy. I do it by myself.
So it seems to be working. So I would stick with that if it's working. But just know the heat and ice are doing two different things. If your body is swollen and painful, ice is what you should be using. So let's say, just so we can wrap this question up, sometimes you go to the physical therapist, for instance, and they'll put heat on your body first, wherever. That is to bring blood flow to that site. So when they're doing whatever work they're doing, it can be more beneficial at that point. When they're finished, however, you'll notice they will put ice because now you are working that knee or arm or whatever, and it's a bit inflamed. And to bring the inflammation, like to take it away from the site, you then put something cold. So it's serving different purposes. So I think for you, if your heat pad is working, it's I guess it's helping the site recuperate or getting blood to that area so the cells are being healed. I don't know about the time that you're putting it though. I mean, heat usually feels good, but for it sounds like a long time to me, but then that's a personal thing. So okay. I hope I
Thanks.
answered your question.
Yeah, that's good about the heat and the ice. And the other thing is the doctor said if I have more pain, I should be getting a hip operation. I don't even want to think of that.
Those things are actually great. So I do have information on that as well. So we'll talk about it later in my presentation and you can readdress it with any more questions.
Thank you.
Okay, you're welcome. So here we have exercise, physical therapy, medications, injections, and surgery and home remedies, which I thought the home remedies was actually interesting for me to research because I didn't have much knowledge on that aspect. So for the exercise, actually I have slides on this as well, but you could see in the picture here, this person is exercising their knee. So this, it's gonna help with the stiffness and the pain and flexibility. Physical therapy pretty much does the same thing, but it's more of in a controlled environment where physical therapy also helps with your balance. So, maybe the physical therapist wants to see you're compensating on the other side of your body. So they'll help to strengthen the weak side, which is more on a professional level. Medications, this is part of the treatment plan. Sometimes you have to use one thing with the other, medications with physical therapy. Injections is another aspect of treating arthritis, and more so for osteoarthritis. Surgery, this was an interesting picture that I placed here because this is someone with rheumatoid arthritis where their toes are, the bones are all deformed. And they actually had surgery to straighten, I guess they cut some of the bone ends and, join them back together and got their foot to look like this. I was amazed. So, and then here we have the natural home remedies. So for exercise, swimming is one of the things that is usually recommended for arthritis because it's so low impact. There's like water therapy or water aerobics. And this stimulates the blood circulation, reduces muscle stiffness, and eases pain. I'm not sure if any of you know about silver sneakers. Has anyone heard of silver sneakers? So silver sneakers is a program, I can't remember who sponsors it, but usually it's paid for with your insurance. A lot of insurance pays for silver sneakers, and that allows you membership in a gym where usually they'll have like water aerobics or exercises for people with arthritis or recovering from a stroke and things like that. So my mom actually uses this service and it's pretty good.
I'd like to put something in there, point of information.
Yeah.
I knew about silver sneakers. I called my insurance and I wanted to know, is that something I could get? And she said, let me check your insurance. And she said, you do not have silver sneakers. I actually knew that part. I wanted to know if I could get it. And she said, in order to get it, I would have to switch out of the particular insurance that I'm in. And they have, the same company can have 15 different insurance kinds of plans. But what she said to me, and this is something I'm bringing up for others to be aware of, she said, under no circumstances should you change your insurance because you have the best insurance. God forbid, you're in a hospital, you have to go to a doctor, you're going to be covered. And that's really, truly where we need our insurance. It costs thousands upon thousands. And so she said, don't do it. She said, if you have to, if I were you, I'd pay out of pocket to go to a gym rather than give up the insurance that you have. So that's something that everybody should check out carefully. If you're thinking of taking an insurance that has it, generally it's because they're offsetting that cost with something less that you're not getting.
And that's a good point, Roberta, because my mom had this issue when she developed a stroke and we were trying to get all the therapy for her. She was getting actually not silver sneakers, but she was getting, I forgot what you call it. There's this card that you get like over the counter things in the drugstore, in the pharmacy.
Right.
And she was getting all these extra things like toothpaste and whatever, but they weren't giving her the services she needed when she got the serious illness. So we switched that. Of course, I agree with you, and this is important for everyone to look at. You never switch your insurance for one particular thing if it's not something that's, if the benefits don't outweigh the risk, basically, is the way we put it. So that's a very good point.
In my particular case, just before the pandemic, I had to be in the hospital 3 different times. And out of pocket, what I paid out of pocket for 3 stays, including an operation, was 0.
Wow.
I paid not 1 penny. And that's, I'm saying to myself, if I had joined Silver Sneakers and taken this other plan, who knows what I would have been stuck with. So
I agree. Good point. Thank you for sharing. So exercise, walking is also recommended because it is low impact as well. It keeps the joints flexible, helps maintain bone health, and decreases your risk of osteoporosis. Now, osteoporosis is seen mostly with rheumatoid arthritis from what I'm aware of. So you definitely do not want, because there's bone breakdown, sometimes you end up with osteoporosis. So of course, we know walking strengthens the bone and builds bone. So this is why it's recommended. So I included here Tai Chi, which I know we are familiar with. Tai Chi helps with balance, strength, and flexibility. And stretching. I think Elaine talked about stretching because stretching and making your body flexible and, making sure those ligaments are well. Anything we're doing in terms of exercising is bringing blood flow to that area. So stretching is definitely going to do that. And of course, prevents any further injuries from, maybe stiffness.
Yeah.
All right,
So
just one comment. I just want to put a plug in for RSS They have terrific Tai Chi classes. And if you participate, you will actually find, if you do it, that your balance is increasing. Your capability of movement and ease of movement is going to be increasing. I highly recommend both of them, both classes.
Thank you.
Thank you, Roberta.
RSS has everything that I can think of. Barbara is smiling. So for physical therapy, the focus there is maintaining and improving function of the affected joint and strengthening and widening range of motion, because maybe someone has limited range of motion. So the physical therapist will focus on, expanding that range of motion. And of course, total body conditioning, which is important all around for stability, because as I was saying before, one side of your body may be weaker than the other side. And if it's not strengthened, totally, you can easily fall or have other injuries, because sometimes we're compensating and using, I've seen people walking and they're trying to avoid pain on one side. So they're putting all the emphasis on, the other side of their bodies. I'm sure we've all seen this before. So for medications for arthritis, it usually starts out with NSAIDs, which is non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, or aspirin. Of course, some people cannot use these because they're taking blood thinners. So usually the doctor would say Tylenol. That's usually the go-to thing initially. And then there's Tylenol with extended relief that works throughout the day. When you get to the point, it's very important. This is, I want to place emphasis on this. If you're diagnosed with arthritis, your doctor is going to initially recommend Tylenol. You should ask your doctor for physical therapy as well. And this is why we were supposed to have a physical therapy doctor. The reason being, the idea is to not just take the Tylenol that's going to help with the pain, pain relief for a certain time. The idea is to strengthen that area, strengthen the muscles, the joint, make sure it's strong. And the stronger it gets, you'll have less pain, So it's usually good to combine the two, because if that doesn't happen later on, you're going to have other issues with inflammation, a lot of stiffness, and it could even reach a point where you need surgery. So we also have here like topical pain relievers, like sprays, creams, and gels. These are usually made with the same ingredients, the NSAIDs. One of them is diclofenac, which is found in this arthritis pain cream, which is, it's called Voltaren. These things work, but of course, they're just temporary. I mentioned here capsaicin, which is a substance that makes chili peppers hot. So it has like a, kind of a burning effect. I think you can also find this where they're making it now without that burning sensation, but it's supposed to like bring blood flow to the area and stimulate that, stimulate the area around where the pain is happening so it can heal from that stimulation of blood flow. Any questions? Okay, so now we're talking about injections, and I think Elaine had a question about this as well. So I only placed 4 of them. There are quite a few injections that are being used for arthritis. So steroids, corticosteroids, this is being used for a while. It's still being used. It numbs the area, reduces pain and inflammation, and lasts for maybe 1 month. And it's best for fast or temporary pain relief. This is not lasting. Hyaluronic acid, this is a compound. It's something found in your cartilage as well. Sometimes it's made synthetically, of course, and then it's a natural lubricant. So they're basically trying to replace it. So they'll inject it in between the joints where cartilage is supposed to be. And that lasts for maybe 6 months in 2/3 of patients, and this helps with moderate osteoarthritis and relieves pain. Now, most of these injections are for osteoarthritis because rheumatoid is treated a little differently. So you have prolotherapy. These are a series of injections, usually with sugar. It's supposed to be something that irritates the site. And when it irritates it, the idea that that irritation is going to stimulate a process of healing afterwards. So they'll inject the sugary substance there. It goes there, creates like an injury, and then your body hopefully heals itself. This lasts for about 3 to 4 months. It's not permanent, and it relieves pain and stiffness in patients who maybe they've tried physical therapy or weight loss and they're still having a lot of pain. So the doctor may try this. One problem with this though is that some doctors believe that constantly putting that sugary substance is gonna cause a different inflammatory effect. So I think if this doesn't work, oftentimes the doctors may not continue with this. There's platelet-rich plasma. I was told about this for me personally because I do have tendonitis on in my left foot, and I did physical therapy. It has not gone away completely, but this was recommended to me. I never tried it. It's where they take out your blood and they like spin it in a centrifuge. So they separate the plasma. And the plasma is where you have a lot of platelets and protein. So it's like richer, it's a richer part of the blood. Then they inject that back into your knee or wherever the areas, has the arthritis. And this lasts for maybe 1 month. The problem with this, it's not usually covered by insurance. So that's a whole different, then you don't know if it's gonna work either. So sometimes it doesn't work, it's expensive. I think might be like $800 or $1,000 for one injection or something like that. So, and it's for mild to moderate osteoarthritis or other injuries like tendonitis, of course. Roberta, you look like you have a question.
Thank you. I have a couple of, it's so nice to see all of these possibilities. None of them seem to be projected to last very long. And
agree.
so are they just repeated and repeated and repeated? And is there some downside to doing that?
They are repeated and repeated, and you can keep doing them, I mean, provided your insurance is going to pay for them. However, it depends on where you're at with your pain, with your disability. If I can give an example, I know my mom is like a classic patient. If she knows that I use her so often, I don't know what she would say. I know, but my mom did have has osteoarthritis, and she kept going for the steroid shots. I know the problem with steroids, they have side effects, for instance. So in any of this, you'd like to do your research or ask, a lot of questions. One of the side effects of steroids, you lose your hair. My mom did lose her hair, and her hair to this day has not grown back properly. And ultimately, she had to have knee replacement, which I honestly say that to me, like that's one of the best surgeries people can do because everything went away, all her symptoms, all her pain, and she's totally fine. So, if you're at a point where you cannot function well enough, you can't walk far enough, which is going to hinder your weight loss, you definitely would have to consider surgery because these things do not last forever. You can try physical therapy. If it's working, like Elaine mentioned, it's working for her for now, unless it reaches the point where I think they usually wait until the patient may say their pain is like a 10 out, or 9 or 10 out of 10. That's pain that you cannot continue with that because the other thing with ongoing pain, it increases your blood pressure. So, you're going to have all these additional things from not taking care of your osteoarthritis, or if it's rheumatoid, well, that's different. But you know, you want to take care of it. So yes, ultimately you may have to move on to surgery.
The other question that I have is this, I don't know how to pronounce it, corticosteroid? Is that the right pronunciation?
Corticosteroid.
Oh, you're so good. Is that
I've just said it's a lot.
is that the same as having a cortisone shot?
Kind of, yes. Mhm. It's steroids and it's a shot. Yes, an injection. So it depends. No, let me rephrase that question. This is an injection that I'm talking about. That's different.
Right.
Steroid shot would be more of like steroids in a needle as a shot. That's different.
So when I was diagnosed with plantar fasciitis and they gave me a shot right into the heel of my foot, that was cortisone, no?
Correct. That's whatever steroid the doctor used, which could be there's different
It's a
types of
steroid.
steroids, correct. And
Thank
that would be like an injection. If you say a shot is more of like a vaccine kind of, you know, I don't want to say a vaccine, but
Yeah. This was
let's say you're taking, for instance, patients with cancer, they're gonna get a cortisone shot because it's going in the muscle. But this is more of like specifically saying an injection, because this is where I guess you can use the words interchangeably. But these injections are specific to injections that are going in between your bone. So this
Okay.
is what these are. Whereas if you're just taking a cortisone shot, I see that as taking like an injection in your muscle.
Okay,
So
I was
that's,
using it interchangeably. Okay,
yeah, so that's why I'm trying to differentiate that, because
thank you.
yeah, these are specifically injections that are going in between your knees. I did have a picture, but I don't know if I left it in my presentation. I'll see if it's still there, where you can see the needle going in between the bones. So then we go to surgery, just kind of like your last resort. So you have a synovectomy. It's where they take out the synovium because usually that's the fluid that's inflamed. So they'll take that out. Sometimes they need to take it out to look at it to differentiate or to decide if you have rheumatoid or osteo, because they do look for certain specific markers in the fluid. So this also reduces pain and swelling for people with rheumatoid arthritis, and it prevents or slows down the destruction of joints. So, you know, you'll have to go for these every 3 months or whenever. I think it's about 3 months is when people go to have this done. The problem with this though, you do it, it creates additional pain and inflammation for the first, I think, couple of days after. So you have to deal with that increased pain and inflammation, and then it goes down and it's fine. So, and of course, several years after surgery, well, they're saying it grows back several years after surgery and the problem can happen. But this can be done. I remember the patient I had was having this done every, I think twice a year. It depends. Some people accumulate more fluids than others. Some people's bones are so, the cartilage is just completely gone that it creates also more inflammation. So it depends on your disease, of course. For osteotomy, this is where they correct, like the picture that I showed earlier, correction of bone deformity by cutting or repositioning the bone, and they reset it in a better position. I don't know if you guys can remember that picture with the toes, where this was like an osteotomy. Then we have arthroscopy, where the doctor goes in with an arthroscope and looks between, you know, looks in the areas between the joints. They call it surgery. I know that's interesting, but it's kind of like a surgery. They can perform like real surgery by cutting, like, you know, if something is hanging, they can cut it or repair it. But sometimes they're just going in to look. It's still called surgery. All right, so they can look here to see, you know, maybe there's something minor that they can go and repair, and that's done. Then there's the arthroplasty, where they actually will go in and it's major surgery, repairing the joint or replacing the joint, like knee replacement or hip replacement. These are, of course, more risky. lasts for more than 10 years, and it drastically decreases pain and other symptoms.
Can I ask a question? When it says lasts for about 10 years or possibly longer, do they then have another replacement done and another at 10 years later, depending on need?
Some people, because there are people who are not maintaining, depends, like some people, oops, let me look at my time. For some people, you know, maybe they're gaining more weight, they're having more issues, the doctor may have to go back in and do more surgery. But if you maintain your weight, keep exercising, this can last the rest of your life. Because usually when this is happening, people are in their mid-years or maybe they're 60. So this can last for the rest of someone's life.
Can somebody who does exercise on a regular basis, because of that exercise, can that actually cause deterioration?
They can minimize it, and they can make it a process where it takes longer for them to need something more drastic.
So you're saying
Yes.
it could be helpful. I'm asking, could it also be detrimental? Could it be making it worse? Because if a person is a runner and they run 5 miles every day, after a certain period of time, I'm thinking, is this helping in terms of strengthening bone and so forth? Or is it deteriorating the joint because of all of the use and the pounding?
It would be deteriorating it. So that's a very good question. Recommended exercises would be walking, not running. You certainly wouldn't want to run because you're right. You are going to make it worse, and you end up having to have surgery way sooner than, probably if you don't. So running, walking, swimming, low impact exercise is what's recommended. Some weight training, exercising in the gym, that's what's recommended. Certainly not running, not something that's going to decrease, like take away more cartilage from your already,
I'm thinking of my sister who's been running for more than 50 years, and she still runs 5 miles every day. And I'm saying, what is she doing to herself?
Does she have arthritis though?
I don't think she has anything. She has everything. Every number is good, no medications, no anything.
Exactly. So she's one of the lucky ones, and her weight is low. So then, sometimes with someone with a lot of weight, you don't want to be running.
She eats right, she exercises, she's a size 0.
Oh boy. I know, lucky her. So for rheumatoid, the treatment is more of, it's a different, treatment plan. It's more of immunosuppressants because this is an autoimmune disease, physiotherapy and medication to slow the disease progress. You have something they call DMARDs, which is anti-rheumatic drugs. Heating works with that. Bringing blood flow to the site. Pain meds would still be NSAIDs and Tylenol. Immunosuppressive drugs, steroids. Therapies would include stretching and physical therapy. And for medical procedures, they'll have like an arthrocentesis, which is where like they pull out fluids from, the synovium to decrease the inflammation. And then they also may need surgery or joint replacement. So that's just some insight into that. I did want to touch on diet and arthritis because this is important. So of course you'd want to focus on eating an anti-inflammatory type of diet. So we all know green tea, omega-3 fatty acids, berries, ginger, turmeric, dark chocolate. These are all great for anti-inflammatory foods. I wanted to focus a little on magnesium because magnesium is actually, it's the 4th most abundant mineral in the body. And 60% of your bones and teeth are made up of magnesium. It functions as a bone stabilization mineral, and the deficiency of magnesium shows that people with deficient magnesium have low-grade inflammation, which if this is happening on a chronic basis, this could be a precursor to developing osteoarthritis. So that deficiency, of course, leads to increased risk for osteoarthritis. So I guess we just all need to eat up our magnesium, leafy green vegetables, almonds, yogurt, black beans, oatmeal, bananas. You can actually put all of this in a smoothie and drink it. That's what I was thinking as I'm looking at it myself. So you can't go wrong. Of course, everything in moderation. So some home remedies quickly. So some of them are pretty interesting. These are mostly for anti-inflammatory, to decrease anti-inflammation as well. So there's something called SAMe or S-adenosylmethionine. I have more on that. The ones that I highlighted are the ones that I have more slides on. There's a boswellia cerate. Some people may be familiar with some of these. Some of them I was not familiar with, to be honest. I had to research them. Indian frankincense. There's a capsaicin, which is that green pepper, like chili pepper or whatever this is good for pain and inflammation. There's turmeric. I'm familiar with that.
But I have a
There's
question
avocado.
about turmeric.
Yes.
I thought there was something with turmeric. I don't know if it's if it does something. I don't know if it has to do with high cholesterol. If there's something that's negative. I can't remember what.
I think what I remember, turmeric, it interacts with warfarin. Like if you're taking blood, Coumadin or warfarin. That's what I'm remembering.
Or maybe it's a contributor to blood thinners, that it will possibly increase that happening.
That's what I'm remembering. I mean, I don't know if my memory is on point.
But
though,
if you're not on a blood thinner, does it make it thinner?
Repeat the question. If you're not on a blood thinner.
If you're not taking any medication, but you're taking the turmeric, are you then having that cause your body to react in a way that it's becoming a blood thinner for you?
It would do that, but I don't think it would do that to the point where it becomes a medical issue, unless you're just drinking tons of turmeric. So the one thing I learned in school when I was studying nutrition, the professor always told us everything in moderation, because if there's a side effect to something and you're taking it every day, hello, you'll end up with that effect. So, so you want to have these things. But of course, I do have a note in one of my slides. Any of these, you should research them well and check with your doctor. It's very important to do that, because you may have a medication that's contraindicated with some of these. So you don't want to just go and start taking them, or you let your doctor know, hey, I'm taking this. So then they can say, oh, wait a minute, So that's what I would say. So you have avocado, soybean, things. These are products that they're making. There's something called cat's claw or Oncaria tomentosa. We know about fish oil, that's always good. The gamma-linolenic acid, there's ginger, and I put CBD oil because I know everyone's into CBD, if I'm not wrong. So I just decided to focus on that one. We do have only a few minutes, so I'm going to try to hurry up. So for the SAMe, it's a compound, it's actually made in your body naturally because it produces and regulates hormones and helps to maintain the cell membranes. However, they've been making a synthetic form of this SAMe, and it's in America, it's a supplement. In Europe, it's a prescription drug. So that's something I wanted to point out. It helps with pain. It's a pain reliever with anti-inflammatory properties, and it also is supposed to help stimulate the cartilage growth. So it also affects neurotransmitters like serotonin, which helps reduce the sensation of pain or pain perception. There were 2 studies that showed that it relieves osteoarthritis symptoms as effectively as NSAIDs with fewer side effects, because one of the things with NSAIDs, I always advise people when they're taking NSAIDs at a high dosage. It's an anti-inflammatory, but one thing it does, it causes ulcers. So if you're taking that and you're not eating, it's going to wear away the lining of your stomach, and you can end up with an ulcer. So oftentimes people would say, oh, I'm taking this medication, now I have a different problem, so it's always important to look at the side effects for whatever you're taking. Another one is the Indian frankincense, which is the active ingredient is the boswellic acids. They have an anti-inflammatory, analgesic, and pain relieving properties. They may also help to prevent cartilage loss, inhibits the autoimmune process. So this works for RA as well. One study actually showed that there's something they extracted, Luxin 5, out of it, and it significantly improves osteoarthritis pain and function within 7 days. Another study also showed it slowed cartilage damage after 3 months of use. So this is beneficial for both OA and RA. We have turmeric. The active ingredient is curcumin. It can reduce joint pain and swelling. It blocks the inflammatory cytokines and enzymes. And it's a long-term, it improves pain and function in patients with osteoarthritis. So there was a small study done, and they used the curcumin products, and they named it BCM 95. It showed more reduced joint pain and swelling in the patients with active RA, rheumatoid arthritis. In comparison to, remember I spoke about the diclofenac sodium? It's an NSAID. So they're saying compared to that, this product reduced joint pain and swelling more than the NSAID, which we know has side effects. So turmeric is best for osteoarthritis, and it does benefit rheumatoid arthritis. Then we have ginger, which is anti-inflammatory properties, is similar to ibuprofen, which is an NSAID, and COX-2 inhibitors. People don't use COX-2 inhibitors a lot. This is like Celebrex. I think this is the only one being used in America now. The others cause heart disease and stroke. So, but they're saying this is similar. In one study, a specialized ginger extract reduced inflammatory reactions in rheumatoid arthritis as effectively as steroids. And then there were studies that showed a certain extract used 4 times daily reduced osteoarthritic pain in the knee after 3 months of treatment. And another taken twice daily worked as well as ibuprofen. So, they're comparing this to medications where we have side effects. And obviously these natural products would not have as many side effects. Of course, I always say to people with home remedies or anything you're taking, the problem with them is that it's not like standardized. So if you're making it at home, it might not always be the same strength. Even if you're buying it, it might not always be the same, so you have to be just a little careful with, don't go overboard with eating ginger in every meal or something crazy, because, you have to study these things in a research setting to have like a fixed dosage to know exactly, what it's doing. So we get to CBD, or cannabidiol, which is the oil. It's a compound made naturally in the body. Your body does make this. And cannabinoids are thought to influence the body's own endocannabinoid system, which regulate biological functions such as metabolism. Pain sensation is what we're focusing on. So there are animal studies done, and it shows that CBD reduces pain and inflammation, but there were no human studies. So I've worked in oncology for years, and people often, we do in oncology, the doctor would prescribe you call it Marinol, where they give it to the patient, but that's to stimulate appetite. So it's different. In this case, there's a CBD oil, which is supposed to help with pain. One study found synthetic derived CBD was effective for knee osteoarthritis, and it's supposed to, of course, benefit both osteoarthritis and rheumatoid arthritis. So to wrap everything up, we want to talk about safety and quality. Talk to your doctor before taking any supplement so you understand the side effects, if there are any medication interactions. You know, the FDA does not test supplements. They're tested by private companies. And if you look at research, I actually have a lot of experience with research as well. We had to do some analysis of research articles, and a lot of times the research, the person who's paying for the research influences what's written in the article. So you'll find it's, you know, it's favoring a particular, like they'll say coffee is great for you, but who's paying for that research? It might be Starbucks. So, you know, so you have to be so careful with research. It has to be peer reviewed, where there's a lot of scientists working on the same thing that, you know, and they're coming to the same conclusion. So research these products and share the information with your doctor. And you can also find supplement information on the NIH's Midline Plus website.
I just want to point out that you have to also be careful with research, because I know that when I did my research, when I was doing a degree, you just change the standard of deviation by a few points and you get a completely different result. And if you're, and so it's not how big is your study, you know, how many people were involved, was it even in your category of age or whatever might pertain to you. So
Correct.
sometimes I take a look at some of these study results and I say, wait a second, I've got to find out more about the study, and first who sponsored it, as you say.
Exactly. Yeah. Thanks for that information, Roberta. So that's it.
That was
Any
very
questions? Hi, Dale.
Thank you, Petronella. This is really good. Very good, very
Petronella.
thorough. Yeah, very
Dale, I
thorough.
love your top. Look at that top on Dale. Woo, woo, I love it.
I know, right?
You look like you should go somewhere. Look at the jewelry and the earrings. Oh
Oh,
my
yeah,
God,
that's nice.
I like to look
With
cute for
fancy.
myself.
you do it well.
Well, I
Yes,
will take
thank
notes.
you. Yep, thank you, Petronella. Once again, excellent presentation.
Thank you.
Do I need to say
Thank
that
you,
again? Because
Renee.
you know it's true.
I second the motion. I agree.
Thank you.
Thank
Thanks, everyone. You guys made my day, because I honestly thought we only had 2 people again. I'm like, oh, why am I doing?
You gotta have faith, Petronella.
Barbara,
Gotta
take
have
the
faith. You
recording
get a
off.
following.
Yes.
Barbara,
Thank
take
you.
off the recording.
Thank you.
All right, well,
Thank you
thank
so
you very
much.
much,
Have a good
everybody.
week.
Thank you so
Okay,
much.
thank you
everyone.
too.
Bye.
All right, we'll see
All
you
right,
soon.
bye.
Take care. All right,
Bye-bye.
bye-bye. Okay, you did good. Oh, all right.